Here is a question worth sitting with for a moment. Why is it that the stiffest your body feels all day long is in the first half hour after you wake up, before you have lifted a single thing, before you have walked a single mile, before you have done anything at all to earn it? You have rested for 8 hours. By every reasonable expectation, you should feel your best. Instead, for millions of people over 60, the morning is the hardest part of the day. The hands won't close all the way. The knees creak going down the stairs. The lower back feels like a rusted hinge that won't swing. After 30 years of clinical observation, I can tell you the morning stiffness almost nobody explains properly is rarely the thing people fear it is. It is usually not the beginning of crippling arthritis. It is usually not your joints wearing out for good. And in case after case I have seen documented, it improved, sometimes dramatically, once a person understood the 5 reasons behind it. Most of those 5 reasons never come up in a 12-minute appointment. Not because your doctor is hiding them, because there is simply no time to explain them. Before we go further, a quick and important note. This is educational content, not medical advice. Nothing here replaces an evaluation by your own physical therapist or physician. If you have had recent surgery, if you have severe osteoporosis, if your balance is significantly impaired, or if morning stiffness lasts well past an hour and comes with hot, swollen joints, please bring that to a clinician. Prolonged morning stiffness can be a sign of inflammatory conditions that need a proper diagnosis. With that said, let me show you what 30 years of watching this pattern taught me. Let me give you the picture that explains all 5 reasons at once, because I want you to carry one image through this whole video. Think of a joint as a door hinge. A good hinge is quiet and smooth because it has a thin film of oil between the moving parts. Leave that hinge still and cold overnight and the oil thickens and pools at the bottom. The first few swings in the morning feel rough and resistant, but you don't replace the door. You move the hinge a few times, the oil spreads, the warmth returns, and it swings freely again. Your joints behave almost exactly like that hinge. Hold that picture. Here are the 5 reasons that hinge feels stiff at dawn. Reason 1. Your joints make their own oil, and overnight it goes thick. The fluid inside your joints is called synovial fluid, and it genuinely behaves like a lubricant. It is thicker when it is cool and still, and it thins and spreads when you move and warm up. After 8 hours lying flat and motionless, that fluid is at its most sluggish. The stiffness you feel in the first steps is, in large part, the hinge waiting for the oil to spread. This is why the stiffness eases within 10 or 15 minutes of gentle movement. If it didn't ease at all, that would be a different conversation. The fact that it loosens as you move is the clue that it is mechanical, not catastrophic. Reason 2. You stop moving for 8 hours, and tissue tightens when it is still. Muscles, tendons, and the connective tissue around your joints respond to position. Hold them in one shape for hours, and they shorten and tighten to fit that shape. We see this most clearly in the calves, the hamstrings, and the small muscles along the spine. The morning is simply the longest stretch of stillness in your day. The stiffness is the tissue protesting the position it was parked in, not a sign of damage. Let me pause here for a moment because the next reason is the one that surprises people the most. Reason 3. Mild overnight swelling that you can't see. Through the day, when you are upright and moving, your muscles act like pumps, pushing fluid through your tissues and back toward your heart. When you lie still all night, that pump is switched off. A little fluid settles into and around the joints. It is usually too subtle to see, but you feel it as puffiness and stiffness, especially in the hands and the knees. The moment you get up and start moving, the pump switches back on and that fluid clears. This is why the hands that won't close at 7 o'clock work perfectly by 9. Reason 4. The reason that has nothing to do with your joints at all. Your sleep position and your mattress. Case after case, I have seen documented traced morning back and hip stiffness not to the joint, but to a sagging mattress, a stomach sleeping habit that wrings the lower back, or a pillow that left the neck cranked at an angle for hours. If your stiffness is worst in the back, the neck, or one hip, and it eases within 20 minutes of rising, the sleeping setup deserves a hard look before the joint takes the blame. This is one almost nobody connects, and it is often the cheapest thing on this entire list to fix. Reason 5. Your body's natural anti-inflammatory rhythm is at its lowest in the early morning. Your body runs on a daily clock, and the natural hormone that helps keep inflammation in check follows that clock. It dips to its lowest point in the pre-dawn hours and climbs after you wake. So the early morning is, by your own biology, the moment your body is least equipped to quiet down minor aches. This is not a flaw you broke. It is the rhythm everyone has. And it is one more reason the same joint that screams at dawn can feel almost normal by mid-morning. Stop here. Take a breath. Because now that you understand why the hinge is stiff, the fix becomes obvious, and it is gentler than you would expect. You do not need to attack stiff joints. You need to warm the hinge and spread the oil. Let me show you 2 simple things to do before your feet ever hit the floor, and 1 to do once you are up. The first is what I would call bed-level mobility, and you do it lying on your back before you stand. Bring one knee slowly up toward your chest, only as far as is comfortable. Hold for a slow count of 3 and lower it. Then the other side, 5 on each side. Then, with both feet flat on the bed, let your knees drift gently to one side, then the other, like windshield wipers, 10 slow passes. This is the equivalent of swinging the hinge a few times before you ask it to carry the door. It wakes the joint fluid up while you are fully supported, and there is 0 fall risk. If getting onto your back is difficult, you can do a seated version on the edge of the bed, gently marching the knees up one at a time, and slowly straightening and bending each knee. The second is ankle pumps and gentle fists, still in bed. Point and flex both feet 20 times. Open and close your hands 20 times. Remember reason 3, the overnight pooling of fluid? This is you switching the muscle pump back on before you even stand, so you rise to less puffiness and less stiffness. Mild discomfort as things wake up is normal. Sharp pain is a stop signal. If anything sharpens, ease off. The third, once you are standing and steady, is a 30-second warm-up at the kitchen counter. Hold the edge of the counter for support and do 10 slow, shallow knee bends, a few inches only, never into pain. Then rise onto your toes and back down 10 times. The counter is your handrail. Never do these in open space first thing in the morning. This spreads the joint fluid through the knees, hips, and ankles you are about to ask to carry you all day. Do these 3 things, and most people find the morning that used to take an hour to shake off is gone in 10 minutes. Now let me answer the objection I can already hear. But mine doesn't go away. Mine lasts all morning. If your stiffness lasts well beyond an hour, if it comes with joints that are hot, red, and visibly swollen, or if it is paired with deep fatigue, that is exactly the picture you take to your physician, because that pattern can point to an inflammatory condition rather than the mechanical morning stiffness we have been describing. The duration is the tell. Mechanical stiffness loosens with movement and warmth. Inflammatory stiffness lingers. Knowing the difference is not about frightening yourself. It is about knowing which door to walk through. Let me show you what this looked like in one composite case. A man I will call Walter, 71, a retired letter carrier, was convinced his knees were finished. Every morning, the first walk to the bathroom felt like walking on gravel, and he had begun to dread the day before it started. He had quietly stopped meeting his friends for early coffee because the mornings were so rough. When the pattern was looked at properly, 3 things stood out. He slept on a mattress older than some of his grandchildren. He had not moved a joint deliberately before standing in years. And he was bolting out of bed straight onto cold, unprepared knees. None of it was the catastrophe he feared. He changed the mattress, added 3 minutes of bed-level movement, and warmed up at the counter before walking. Within a few weeks, the gravel feeling was mostly gone. He was back at early coffee. Nothing about his knee structure had changed. What changed was that he stopped asking a cold, dry hinge to carry the door. I want to be careful and fair here. There are people whose morning stiffness reflects significant joint disease, and movement is part of the answer, but not the whole answer for them. A 2015 review in the Cochrane Database of Systematic Reviews by Franson and colleagues pooled 54 trials and found that consistent exercise meaningfully reduced pain and improved function in knee osteoarthritis. And the Danish GLAD program, built on the work of Sko and Roos, has followed thousands of people with knee and hip arthritis through a simple education and exercise program and reported average pain reductions in the range of 30% without surgery in many participants. The point is not that movement erases every problem. The point is that for the ordinary morning stiffness most people over 60 feel, gentle, consistent movement is closer to the cure than to a coping strategy. Now let me give you a few more practical pieces because the morning does not start at dawn. It starts the night before. What you do in the evening shapes how the hinge feels at 6 the next morning. 3 things in particular matter more than people realize. The first is hydration. Remember that joint fluid behaves like a lubricant, and a body that goes to bed slightly dehydrated produces thicker, less generous fluid overnight. I am not telling you to drink a pint at bedtime and be up 3 times in the night. I am telling you that gentle, steady hydration through the day, tapering in the evening, leaves the hinge better oiled by morning. The second is the last hour before bed. A body that goes from the armchair straight to the mattress, having barely moved after dinner, locks in tighter than a body that took a slow 5-minute walk to the end of the road and back. That short evening movement is a deposit you collect the next morning. The third is warmth. A joint that is cold is a joint with thicker fluid and tighter tissue. A warm shower in the morning, or even running warm water over stiff hands before you try to use them, does in 90 seconds what waiting around does in 30 minutes. Let me also be honest about expectations, because I never want to oversell. The first week of doing the bed-level movement and the counter warm-up, you may notice only a small difference. That is normal, and it is not a reason to stop. The change in morning stiffness tends to build over 2 to 3 weeks, the way a garden responds to consistent watering rather than a single soaking. By the 3rd week, most people in the cases I have reviewed describe the same thing in their own words. The morning is no longer something they brace for. They get up, they move a little, and within a few minutes the day is simply open to them. There is a quiet dignity in that which is hard to put a number on. The difference between dreading the first 10 steps and not thinking about them at all. I want to add one more reflection here, because it matters for how you hear all of this. For a great many people over 60, the fear underneath the morning stiffness is not really about the stiffness itself. It is about what the stiffness might mean, the worry that this is the first visible crack in a body that is starting to fail, the beginning of becoming someone who needs help getting going each day. I understand that fear, and I will not dismiss it. But the truth in the cases I have reviewed is gentler than the fear. Ordinary morning stiffness is one of the most responsive, most reversible signals the aging body sends. It is a hinge asking to be swung, not a structure announcing its collapse. So before you let the morning convince you that your body is wearing out, run through the 5 reasons. The thick overnight fluid, the tissue tightening in stillness, the pump switched off all night, the sleeping setup nobody checks, and your own low-tide anti-inflammatory rhythm at dawn. 4 of those 5 you can influence starting tomorrow morning, before your feet hit the floor. Talk to your physical therapist or physician about your particular pattern, and bring this list with you so you can have a real conversation rather than a rushed one. And remember the order, because it is the whole secret in a sentence. You do not stand up and then wait for the stiffness to fade. You wake the joint while you are still lying down, switch the pump back on with your feet and your hands, warm the hinge at the counter, and only then ask your body to carry you into the day. Do it in that order, every morning, and you give the hinge the few quiet swings it has been asking for all along. Take care of your knees. Take care of the people who love you. And tomorrow morning, before you stand, swing the hinge a few times first.